Afternoon. Our lecture for this afternoon would be Family Assessment Tools. The patient is a member of a family, and studies have shown that the way a patient reacts to an illness depends a lot on his family. Many health problems seen in practice can neither be understood or successfully dealt with when considered as isolated phenomena affecting only one person. The works of several investigators lend credence to the hypothesis that the treatment of the family as a unit yields more certain and complete diagnosis, better medical outcome, and better benefits with regard to prevention. That is depending entirely on the family physician to what level he will involve his family in evaluating a patient's problem. This discussion presents an overview of family systems medicine and outlines the way in which a practicing family physician can incorporate family orientation in clinical practice. Learning objectives for this lecture would be to describe the advantages for assessing family, define different family tools such as the family genogram, family map, family APGAR, and its function. So why do we need tools to assess the family? We need tools to help us how the family functions, to see its family dynamics, to assess coping mechanisms of the family, to assess the resources in coping with illness, and assess family structure. We need to have a picture of the multi-generational patterns of behavior or illnesses, to assess the normal crisis or common illnesses to be encountered in each stage of development, to provide anticipatory care and guidance. An understanding of the family in terms of the struggles to be functional will enable family physicians to make correct diagnosis and make the appropriate intervention. So family dynamics would be interactions and relationships among the individual members of a family. This reflects and influences the physical, mental, and spiritual health of the individuals in a family. A patient who comes to the clinic with a health problem cannot be fully understood by considering only the pathophysiology of the medical problem. Better evaluation and thus better healthcare results if family relationships, family social and cultural systems are all considered. The family physician in practice views the patient's problem in multiple contexts. Herein lies the focal point of family systems medicine. A family systems approach to common clinical situation can facilitate a new level of understanding of a patient's problem. However, to be able to develop a family systems approach to patient care will require the understanding of some basic concepts about the structure and function of the family. So family systems medicine, step 1 would be to recognize the family structure. The very first step in understanding the family is to know the individuals in the family. The following information should be obtained: name, residence, roles, stage of the family life cycle, and a good way to obtain this is the family genogram. The family genogram is a scheme or graphic chart representation of which the genetic pedigree of family and key psychosocial and interactional data using standardized symbols. It is a biopsychosocial family tree. It records the family in its life cycle, family illnesses, and relationship. It's a versatile clinical tool that can help physicians integrate a patient's family information into the medical problem-solving process for better patient care. A genogram supplements the problem list, giving family physicians an overview of the main problems affecting the family over 3 or more generations. A genogram can then be drawn in skeletal form during one of the first few visits. Ideally, the first visit and then it can be elaborated during subsequent visits as more is known about the family. These are the genogram components and various symbols that are used in the family genogram. Generally, a square would represent a male, a circle would be a female, and a diamond if sex is not specified. You cross it out if it's deceased. Signify letter A for adopted female, B is for date of birth, M is date of marriage, D is for date of divorce, and a capital D is for date of death. Other symbols such as abortions, pregnancy child in utero, and twins are as follows. Other symbols used in family genograms would be standardized symbols of disease or situation. A double square or double line circle would mean obesity. XXX would mean alcoholism. A dot in the middle would be asthma. Bold outlined circle or square would be hypertension. With a heart would be heart disease. Stroke, depression, war casualty as well. These are also the commonly used abbreviations that would be helpful in making your genogram. And these are the standardized symbols depicting relationships. For example, married and what year, separated and what year, divorced and what year. If you are just cohabiting, your relationship is conflict, you have a long distance relationship, you have a close relationship, and the family that lives together would be enclosed by broken lines. So we have to take note of the symbols. It has to have 3 or more generations with Roman numerals depicted. Name of the family with the date written above to know when was the genogram formed. A listing of the firstborn of each family to the left with siblings listed sequentially to the right. The names of all family members and one member which is of greater medical importance and is known as the index patient and is identified with an arrow. The age or year of birth of all family members, any deaths, dates of marriages and divorces, significant diseases or problems of family members, indication of members that live together in the same household, a key depicting all symbols used, and symbols selected for simplicity and maximum visibility, and date when the chart is made should be indicated. This family information could be used in 3 types of situations. To evaluate somatic complaints by testing biopsychosocial hypotheses, assessing a patient's risk for biomedical and mental disorders, planning management by considering how family factors may facilitate or complicate it. These are the different uses of the genogram. It allows the family physician and other health professionals to review quickly the family situation. It builds rapport by using the first names of family members, knowing who is living in the home. It identifies at a glance significant risk factors such as hypertension, diabetes, cancer, and obesity. It recognizes the need for screening in patients who would be at high risk. It promotes lifestyle changes and health education and demonstrates that family relationship is a concern of the family physician and important to the health of each family member. Draw a family test. This is a simple, practical, and cost-effective tool for assessing family functions that can be administered individually or in a group test. Members of the family are given the opportunity to express oneself and consequently reveal innate difficulties within the family system. It is found to be useful and revealing because of the following reasons. 1. Evasive and guarded patients are more likely to reveal their underlying traits because subjects are more intellectually aware of what they may reveal through verbal communication. The unconscious level, which represents adulterated basic needs, can be expressed through drawing. Drawings are the first to show incipient psychopathology and the last to lose the signs of illness after patient recovery. So it tells about the patient's feelings, relationships they have with people around, self-esteem, and intellectual problems. It's a very informative method of getting to know the patient, especially when working with kids. So you see the relationship of the members. For example, this is a self-drawing by an 8-year-old girl who participated in a support group for children affected by domestic violence sponsored by Cedar Valley Friends of the Family. And one cannot escape sensing this child's unhappiness. The frown she drew on her little face clearly sets the mood. An upside-down rainbow, most significant message. Generally, we think of rainbows as a happy reminder of hope for the future. In this simple drawing, the little girl innocently but quite vividly told us that she was unhappy. So the family WAP was developed by Dr. Salvador Minuchin. It facilitates the communication of information about the family system to colleagues so they can be understood, utilize common symbol with suggested family dynamics. This is an example of a family map. It focuses on the relationships of family members and who has formed coalitions or who is at war with each other, showing their different relationships. The Family Lifeline is a tool that summarizes the history of the family, particularly the individual or the family's significant experiences over a period of time in a chronologically sequenced manner, and includes how the family has coped with distressful life events. The interpretation is based on the most significant event that probably affected the health of each member or influenced the health-seeking behavior or perception in health of the individual or the family. The family lifeline is used to show the family's significant events over a period of time in a chronological sequence. It includes normative and non-normative crises. It is sometimes placed side by side with the illness history, and it helps process how flexible a family is when dealing with these changes. This is a sample of a family lifeline, starting with the death of a mother, then graduation from high school, and other significant events, then being married, and then marital difficulty. Then we have our family APGAR. This is a 5-item questionnaire designed to elicit the patient's perception of the current state of his family relationships and serves as a rapid screening instrument for family dysfunction. Family APGAR is a rapid screen for family function and has a good reliability and validity to measure individual satisfaction with family relationships. Disadvantage would be it needs time to complete. APGAR, letter A is for adaptation, is the capability of the family to utilize and share inherent resources. Letter P is for partnership, is sharing of decision making. This measures the satisfaction attained in solving problems by communicating. Letter G is for growth. It refers to both an emotional growth that measures the satisfaction of the availability, freedom of change. Letter A is affection, is how emotion like love, anger, and hatred are shared between members. This measures the member's satisfaction with intimacy and emotional interaction that exist in the family. R is for resolve, and this refers to how time, space, and money are shared. This measures the member's satisfaction with the commitment made by other members of the family. So this is the APGAR questionnaire. Each question would be answered with a 2, 1, or 0. Almost always would be 2. Some of the time would be 1, and hardly ever would be 0. You would be asking questions such as, I am satisfied that I can turn my family for help when something is troubling me. For letter P is, I am satisfied with the way my family talks on things with me and shares problems with me. For growth, I am satisfied that my family accepts and supports my wishes to take on new activities or directions. For affection, I am satisfied with the way my family expresses affection and responds to emotions such as anger, sorrow, and love. And R would be, I am satisfied with the way my family and I share time together. Part 2 of the family APGAR simply lists who lives in your home and how do you get along. If you do not live with your own family, list the persons to whom you turn to for help and how do you get along. Scoring would be 8 to 10, which show a highly functional family, 4 to 7, moderately dysfunctional, and 0 to 3, a severely dysfunctional. The next family tool would be SCREEM. S is for social, which means the resource would be social interaction is evident among family members. To show a pathology would mean family members are isolated from each other and other groups. Cultural resource would be cultural pride or satisfaction can be identified, especially in distinct ethnic groups. Pathology of which would be family members experience ethnic and cultural inferiority. Religious, often satisfying spiritual experiences. Pathology would be family members may observe very rigid dogma and religious rituals. Economic stability is sufficient to provide both reasonable satisfaction with financial status and an ability to meet economic demands. If it's difficult to meet economic needs, it's a pathology. Educational, education of family members is adequate. Pathology would mean handicap to comprehend important issues or details. And medical, healthcare is available through channels. Pathology would be family members fail to utilize these health resources. BATE techniques could also be used. It's a 15-minute method of primary care counseling. So it helps outdraw the quiet patient and provides a structure of when to move on in a talkative patient. B is for background, A is for affect, T is for troubling, H is for handling, and E is for empathy. B is background and you assess the background situation or areas of which the problem lies. So how are things at home, at work, and what's the difference in your life between now and before? A is your affect, how the patient's affect about common things affect. So how do you feel about your home life? How do you feel about school? Then T is your troubling, the problem that is most troubling for the patient. So what's your problem? What stresses you out? Etc. H is for handling, the manner in which a patient has been handling the problem. And problems are often mishandled life difficulties. And E is for empathy. So it's a response that conveys empathy and that you understand the patient's distress. So you would say, I can understand that you would feel angry. That must have been difficult. That's a tough situation to be within, etc. And then you have your family circle. It's a brief graphic method for disclosing, gathering, and discussing family dynamics as discussed by one or more family members. It is often used in individuals, but they can be applied to small groups. Through this tool, one can assess openness, boundaries, support, function, triangulation, and interdependence in the family. Difficulty of interpretation and standardization poses as a disadvantage. So this is an example of a family circle and how one individual may represent his or her own family. And lastly, there are levels of family involvement, and it is essential for family physicians to know how, for they can go in assessing family dynamics and their relation to healthcare. So level 1 would put minimal emphasis on the family in the delivery of healthcare. Level 2 would be ongoing medical information and advice. Level 3 would be feelings and support. Level 4, assessment of family dysfunction and provision of intervention. Level 5 is family therapy. And to end, life is far too short to be sad, to be mad, to hold regret, to look back, to be depressed, to be unkind. So be nice and always do good. Every day is new. Thank you for listening to this preventive medicine and community health lecture. Please do subscribe to my channel for more lectures on preventive medicine and community health. Thank you.